Good day, ma'am. I am Krishna Del Tayo po, your nursing aide for today. And today we're going to demonstrate providing tracheostomy care. The purpose of this procedure is to maintain airway patency, maintain cleanliness, and prevent infection from the tracheostomy site, facilitate healing, and prevent skin excoriation around the tracheostomy site, and to provide comfort. As for assessment, we need to assess the client's respiratory status, including ease of breathing, rate, rhythm, depth, lung sounds, and um, oxygen saturation level. Also, pulse rate, character and amount of secretions from tracheostomy site, the presence of drainage on tracheostomy dressing or tie. And next, appearance of incision. We need to note for any redness, swelling, purulent discharge or odor. Next, planning. For planning, we need to identify the patient. So, for identifying the patient, we need um, to look if the patient is conscious. We can ask him or her. But if the patient is unconscious, we can check the hospital bracelet. And ask the relative if they are present, also check the chart for the verification. Next, we need to determine the need for tracheostomy care. Assess the patient's pain, and we need to administer the medication if needed. Afterwards, we need to explain the uh, procedure to the patient, what we are going to do and why we are doing it to the patient. Even if he appears not to be alert, we need to reassure that he can or she can interrupt me or us uh, during the procedure, even if he or she feels or encounter respiratory difficulties. Next, perform hand hygiene. After performing hand hygiene, we can adjust the bed in our comfortable working position. Then, lower side rails closer to me if applicable. Afterwards, if the client is conscious, we can place him in semi-Fowler's position. But if he is unconscious, just remain in lateral position. Next, place the bed table closer to my working area with the equipments on top. Next, the trash receptacle should be within reach of my working area so that we can save time and effort during the procedure. Then for implementation, we need to put face shield, goggles, and mask. Then suction the tracheostomy if necessary. But if the suction is complete or done, we only need to remove the dressing and discard. But we need to discard it prior to removing of the gloves that we use for suctioning. Then next, for cleaning the inner cannula, disposable inner cannula of the tracheostomy. First, we need to prepare the supplies, and we need to open the tracheostomycare kit separately with the basins. But if not complete in the kit, we need to open sterile 3 sterile basin. Then next, we need to fill the first basin with 0.5 hydrogen peroxide. And or dip with hydrogen peroxide, or we can do 1/2 hydrogen peroxide and 1/2 saline, according to facility policy or hospital's policy. Next, we need to fill the other two basins with 0.5 dip with hydrogen peroxide. Afterwards, we need to place a rubber pad on the chest of the client to protect him from any secretions. Afterwards, we need to put on gloves. Put on disposable gloves. Then we need to remove the source of oxygen. Excuse me, sir. And we need to remove the dressing that involved, and then afterwards, we need to put the face, hold the face plate, and we need to rotate this inner cannula counterclockwise and release. Then the non-dominant hand should be holding the faceplate, not the inner, just the. Then we need to drop this one carefully in the basin and replace the oxygen source. Then we need to remove the gloves. Next, for cleaning the inner cannula, first we need to put on sterile gloves. Then we need to remove the inner cannula from the soaking solution. Moisten with brush with a cleaner. This one. We need to clean this one. Then we need to tap it. Then after cleaning it, we need to return it and close Then we should hold the faceplate and close. We need to rotate it in clockwise. Then check the inner cannula if it was secure, and if needed, we reapply the oxygen device. Then afterwards, but if not needed, we just stay at in that place during this time, so that after finishing our task, we can return it to the client. Then we need to dip the applicator, cotton applicator or gauze sponge in the second basin, and we need to clean the stoma under the base plate. So we can hold this one and we clean it outward. Afterwards, we need sponge or sterile gauze pad to dry the around the stoma, and we just gently pat to make it dry. Afterwards, we need to place 4x4 under. We just need to remove that one and replace new one. Just slide it. Oh my gosh, why are you going out? And next, after we put that, we need to change the tape. But before changing it, we need to place new one. Ties or tape, and we need to tie it in square knot. Make sure that the space between the neck and the thigh is 1 finger, so that too tight and not too loose. Afterwards, we need to check the patient if he can reflex back. Then if he can, we need to remove the old ties and discard to the proper place. And after that, we need to return the oxygen device. Then afterwards, remove the face shield or mask, then goggles, and then remove the gloves and discard. Afterwards, perform hand hygiene. After performing hand hygiene, reassess the patient's we need to reassess the patient's respiratory status, including the respiratory rate, effort, oxygen, saturation, and lung sounds. Then, for documentation, we need to record respiratory assessment before and after the tracheostomycare. And then, the type, size of tracheostomy tube, the frequency, the extent of the um, care type, the color, and the amount of secretions that we remove from the suction or the tracheostomy site. Also, the patient's tolerance towards the procedure, and then special care in event of unexpected outcome. So, the patient, before the procedure, his vital signs is the blood pressure is 155 over 89. Then the respiratory rate is 20, temperature 99.3 Fahrenheit, the pulse is 95, and the oxygen saturation or SpO2 is 88%, which is lower than the usual normal. And it has a sounds of crackles in his chest, lungs when auscultated. Then when suction, we see the not too much secretion, but as a small amount, and it was in color white. Then afterwards, after the procedure, the vital signs of the patient is the pulse is 75, the blood pressure is 135 over 75, the respiratory rate is 16, and the temperature is 99.0, and the saturation, the oxygen saturation level is 97%, and there is no crackles when auscultated, and just a small amount of white oropharyngeal secretions removed when suction. And the size of tracheostomy tube, the outer diameter of the tracheostomy tube, 2/3 and 3/4 of the tracheal diameter, then 10 millimeter per mercury, whilst the outer of is 11 millimeter, suitable for the most adult patients, males. Afterwards, all over, the patient is better, and that's all. Thank you.